Hi, I'm Naturopathic Dr. Samia McCully, and today I wanted to talk to you about vitamin D. Vitamin D is something that is incredibly important to our health. It impacts us in many ways, and without it, we can feel depressed, anxious, have difficulty sleeping, we can be tired, we can have frequent illness, we can have increased pain. It really affects us on a whole lot of levels. And the reason I wanted to talk about vitamin D today is because something I discovered recently really concerned me. So we have different labs all over the country, and those labs have different normal values. And one thing that I think it's important to know is that the normal range for any lab value is what 95% of the population falls inside. So we know that 95% of the population is not healthy, truly healthy. And really what we want to do usually is fall somewhere in the middle of that range. Although sometimes those ranges tend to be a lot lower than they should because the population is a lot sicker or more deficient in a particular nutrient or vitamin than something else. So with vitamin D, our normal lab values have been 30 to 100 typically in most labs for the last 10, 13 years that I've been practicing. And in January, a lot of lab values changed. So what was 30 to 100 became 20 to 70, 20 to 80. And so that may not sound like a big deal to you, but if your doctor doesn't know what an optimal value is, and I consider optimal to be between 75 and 85, it can have a big impact on you because you may really need vitamin D. Say you are at 21, which is a very low vitamin D value, and your lab considers it normal. If your doctor doesn't know the optimal values, you can be suffering from all the symptoms I already mentioned: depression, anxiety, insomnia, fatigue, increased pain, increased sickness, and not know that it's simply a vitamin D deficiency, and you could be getting put on all kinds of drugs that you really don't actually need. Something that alarmed me, and I would almost say scared me, made me pretty angry recently. I had a patient who we got her lab results back and it was flagged as high. Her value was 50 for her vitamin D. So in a range of 30 to 100, 50 is actually on the lower end of normal. And when you have a value of 50 that's being flagged as high, there's something definitely wrong there. So I did a little research, and the normal value that was given for this hospital, it was a local hospital around here, was 13 to 48 was considered normal. So anything above 48 was considered too high. And depending on who this patient is seeing, she could be told to get off of her vitamin D because she's taking too much, when in fact, in my mind, she's not actually taking enough. So I called this hospital and confirmed with them that there was no mistake and that the 13 to 48 range was normal for them. And I was pretty perplexed and have since then come to realize it's likely because a hospital tests on a sicker population than the average population, and so they have a much lower average. But what's frightening about this is someone who has a vitamin D of 13 or 14 and is considered normal can really be suffering quite a lot, and it ends up being, you end up having much higher healthcare costs because you're treating symptoms that are really should have been solved with a simple nutrient supplementation or sun exposure. And we just don't, things are being identified wrong, and it's increased testing because you've got to find out what else is going on from all these symptoms that they have. You have more medication expenses that really there's no need for. So it's really important that your doctor knows what a normal value is or what a healthy value is, and that they're not just relying on the lab to tell them what's normal. And that's pretty true for most people. They're relying on the lab to tell them if something is in range or out of range, because different labs do have different ranges. So if you're going to get checked for vitamin D, make sure you know that a healthy value is between 75 and 85. And if you're a little bit lower than that, that's fine. But if the range of your lab is a lot lower, I would either make sure your doctor knows what the normal range is, or maybe that you start going to a different lab. And supplementation for vitamin D values. You also need to have a doctor who knows how much vitamin D will get you up to the optimal range. So, food for thought, and I think important to know. Thanks, and have a good day.